station. The morning show starts now.
All right, as the kids head back to school, it is time to make sure that their allergy problems are taken care of. Uncontrolled symptoms at night can lead to sleep abnormalities, including sleep apnea and loss of sleep, which of course is no good on the first week of school. Joining me now is Dr. Kalpana DiPasquale from St. Augustine Ear, Nose, and Throat, and she's telling us how to treat some of these symptoms. But the first thing you need to know is whether it is in fact allergies or whether they have something going on. And really, sometimes going to the pediatrician isn't going to answer that question for you.
Sometimes it doesn't, especially when you have a child that's not really responding to medical therapy as well as they should. If they've been on medications for several months and they're still having symptoms, at that point you might want to consider something else is going on. And I think it's really easy to assume everything is allergies, especially when we live here in Florida. But we have to realize there are other things that can contribute to the nasal congestion and obstruction, like a deviated nasal septum, chronic sinusitis, acute sinusitis, and or polyps, which are a little more rare, but can definitely be part of the problem.
So if you figure out that they do have some sort of allergy going on, what is your next step with that? Because there can be all types of side effects that can really interfere with a lot of different things.
Yes, absolutely. So typically, if the child is deemed to have allergic rhinitis, the best thing to do is get them on some medication. What's hard is that a lot of times parents don't think that treating allergies is really that important, just because it tends to be underreported. It's not a life-threatening condition, but it does affect 40% of the children in the world. So it is pretty common.
Very common.
And it's actually more problematic than asthma in some cases. So it does need to be treated because, as we know, it causes sleep problems, productivity issues, absenteeism in school, and presenteeism when they show up to school, but they're not really there. That happens at work, too, apparently.
Because you do. I mean, you feel a little bit out of it, you know, when your head's all full of fluid and everything. You were just talking about some of the secondary symptoms. What are the uncontrolled symptoms?
Well, a lot of times with allergic rhinitis, you can have a spin-off of other symptoms, because when you have allergies, you have an inflammation and a congestion in your nose, and then therefore from there you can develop polyps. You can develop chronic sinusitis where the openings of the sinuses close off. You can develop eustachian tube issues, which is a little tube that connects the back of the eardrum to the back of the nose, and you can have pressure equalization issues, muffled hearing. So it really can be very, very problematic for kids as they're trying to pay attention in school.
And this really can lead to bad grades?
It can, absolutely. I mean, there's been studies done that show, there was a study done in 2007 that showed that the children that were studied had significantly poorer grades when they were suffering from untreated allergic rhinitis. And the thing is, if you don't treat it effectively, it's actually more expensive to treat as a country as a whole later on.
And it is seasonal.
It is, well, that's
to a degree.
To a degree, yes. About 46% is seasonal, and about 50-something% is not seasonal, which is perennial. So, but the most common times are the spring and fall. As we know, that's when everybody's always complaining about their nose and nasal obstruction.
When you're talking about medicines, a lot of these are just getting the proper over-the-counter. It can be that simple.
It can be that simple, but with children, I really recommend being evaluated by a physician, because all medications do have side effects. The dosing can be different depending on the medicine and the age of the child. So under 12, we do different dosing than over weight-based and whatnot. So it's always good to check with the physician, I feel, especially for a child, even if it's over the counter.
And let's talk about the difference between, going to your pediatrician and going to an ear, nose, and throat specialist.
So a pediatrician can really do a lot as far as the initial evaluation and treatment, but as an ENT, we have things in our practice that we can do that the pediatrician may not have. For example, and if the child is old enough, we can look into their nose a little bit better with a tiny little telescope. It's actually very well tolerated. We can perform allergy testing to prove or disprove whether they do or don't have allergies. Sometimes in much more severe cases, a CT scan may be necessary to see if there's more sinus things going on. And some of us ENTs have it in our office as well, like I do. So it makes a big difference, because then you know that you're treating the exact correct thing, and the treatment may differ, and that makes a big difference.
All right, thank you so much for coming in and talking to us about this, because I know I was looking at one of the statistics, and what it counted in. It's counted for almost 1 million missed days.
Yes.
In some cases, that's around the country. Just in 1 year.
That's
crazy.
Of school.
All right, thank you for talking to us about this. And of course, we have lots of back-to-school advice on our website, news4jax.com, including how to pack healthy lunches and how to help your child transition into high school. Vic?